Hi everyone, Dr. Amy from Pain Free and Fit and Posturesize. Today we've got a great exercise for those of you with low back lumbar retrolisthesis. It's called the standing pelvic band pull. Hope you enjoy. So in retrolisthesis of the lower back, the problem is that the vertebra has actually slipped due to instability of the soft tissues backwards. And this retrolisthesis puts an abnormal pressure on discs, on joints, on various soft tissues, ligamentum flavum, etc. The problem with retrolisthesis for most people is that the curve in the lower back, the lordosis, has decreased. The lower back has become flatter in its curve. And the angle or the tilt or the inclination of the pelvis is such that it's posterior tilted, meaning that in normal pelvic alignment, the pubic bone and the tip of the tailbone are pretty much level. In a posterior pelvic tilt, the pubic bone is higher than the tailbone, and that motion of the pelvis rocking backwards or posteriorly flattens the lower back. This causes more of a backward stress to that retrolisthesis. So the thinking with this exercise, this pelvic band pull, is to increase your ability to anteriorly tilt or lower the pubic bone, raise the tailbone. This creates an angle at the base of your spine called the sacral slope angle or sacral inclination that allows the vertebra to travel more forward and restore some of that curve, or that natural lordosis to the lower back, taking pressure off the retrolisthesis mechanics that are disturbing the soft tissues in the area. So for this exercise, you're going to need some type of exercise band, a thicker band that's flatter is easier, but you can use any band that's available to you. You're going to attach it or affix it at a point that's higher than your hips. You maybe want to take a point about chest level for this band. And you're going to loop the band right under the base of the buttocks. It's going to be attached to or pulling on that crease where your leg meets your buttocks. That's the ischial tuberosity. When I walk away from the band, so I induce some tension in it, the natural tension of the band is going to want to posteriorly tilt the pelvis. It's going to want to make my problem that's associated with retrolisthesis worse in terms of pelvic tilting. It's trying to raise my pubic bone up and lower my tailbone. And you'll feel that as you walk back from it. It's like sitting on a swing. It just wants to move your pelvis in a way that's going to flatten your lower back. What we're going to do is we're going to engage all our corrective tensions for our spine. Now, if you don't know what your unique mechanical problems are in your lower back spine that are affecting your retrolisthesis, I highly encourage you to check out a body analysis that we have either at the Pain Free and Fit or Posturesize.com website. You have to learn about your posture, because if you're using this or any corrective exercise and you don't know how to hold your rib cage in a certain neutral position, if you don't know how to tilt or twist your pelvis, engage certain muscles like your multifidus, your transverse abdominis, your obliques in a certain way that's going to cause a balanced muscular contraction from right to left sides, front to back on your body. Doing this or any other exercise may increase the dysfunctional mechanics on your retrolisthesis and actually add to more pain. So you have to learn how to set yourself. If you need to hold your left hip down slightly because you hip hike on that side, if you have a tendency to rotate your torso to one side because you have an active external oblique or internal oblique on the opposite side, you know how to set yourself to be in a neutral posture or neutral spine position, beneficial effects of this exercise. So once I set my RPI or neutral spine, I'm going to allow myself to step back until I feel a decent amount of pull, wanting to move my pelvis posteriorly. I'm going to resist that pull, and as I hold myself ear, shoulder, hip, and knee vertically aligned, I'm going to simply rock my pelvis by lowering my pubic bone and raising my tailbone. And that's going to pull the band a little bit. You'll notice the band stretches as you do that. You're only going to go as far as it takes for you to feel a comfortable amount of contraction in your lower back muscles. Your erector spinae muscles in the lower back are going to be firing. Your pubic bone is going to be lowering. Hold it for a few seconds and then release. So what I'm doing is I'm literally raising my tailbone up, lowering my pubic bone. My whole pelvis is going to rock anteriorly, and I'm going to increase that arch in the lower back. Again, you could do this for repetitions, holding a few seconds at a time, Or you could do it for an endurance workout where you tilt and hold for longer and longer periods, working up to a minute, 2 minutes, even 3 minutes at a time. The more you do this, the more you're going to be conditioning the muscles that anteriorly tilt your pelvis, taking pressure off of that posterior tilted pelvis as it relates to your retrolisthesis. If you like this video on retrolisthesis and standing pelvic tilting, feel free to subscribe to our channel. We got a lot of great videos out there to help you learn spinal stability. If you're looking for a custom program to learn what your unique posture, core, mechanical issues are of your lower back, go to the painfreeandfit.com website. We've got a free body analysis. We also have our low back healing exercise program that teaches you how to find a neutral spine, how to correct your different mechanics, how to engage the right supportive core muscles to protect your back, get your back into sports, get your back in activities with a more stabilized spine. Questions or comments, write in. I'll do my best to answer them. If you like this video and would like to help me share it with more people with retrolisthesis, give me a thumbs up below. And I hope this video on retrolisthesis pelvic tilting in the standing position helps you with your chronic lower back pain.